Thank you very much for your patience. And let me welcome you to this session. I know you had plenty of choices, and you chose to come to ours like they announced in the airlines. You chose our airlines over the others, so we are delighted. My name is Purnima Mane. I come from India, but I work at Pathfinder International. I'm the president and CEO. This is a US-based NGO, but that works exclusively in the developing world. We work in 20-plus countries. And the main focus of our work is sexual and reproductive health, mainly, of course, of women, but also we focus on men and boys. So we have for you an extremely distinguished panel to discuss the subject of access to health, a better life for women and girls. I do want to emphasize that we could easily have said access to rights, access to justice, a better life for women and girls, because that would be just as true. But we are going to try and focus on health in particular to make sure that we don't lose sight of this critical area within the entire scope of rights for women and girls. And we're going to look at health in a much broader fashion than some of you may be used to. I'm going to introduce the panelists, but before I do that, I want to thank the organizers, and this is not a formality, but I really thank them for giving this emphasis both on the aspect of health, but also on the aspect of women and girls. It is a critical area. The esteemed group that you have here is going to be exploring sort of a cross-section of issues that are pertinent to the health of women and girls. Let me introduce you to them, and then I will go back and give you, because I've been asked by the organizers to give you, set the scene a little bit before I turn to the panelists. I'm going to start in an alphabetical order. To my right is Mr. Jimmie Briggs. And Mr. Briggs, you'll notice, is the only man in this panel, but that was not because we wanted a token man. He's more than that. He's a renowned journalist, a respected human rights activist, and drawing inspiration from what I understand is his relationship with his daughter. He has focused his efforts promoting gender equality and fighting against violence against women throughout the world. In 2005, he wrote a book, Innocence Lost, When Child Soldiers Go to War, and it was a book that won him accolades. His upcoming book, The Wars Women Fight, Dispatches from a Father to His Daughter, talks about issues that he's seen in DRC, Democratic Republic of Congo, Afghanistan, and Guatemala. He's received several prestigious honors, and he serves as the executive director of the ManUp campaign, an organization that he co-founded which aims to end violence against women throughout the world through youth-led initiatives engaging men around the globe. To his right is Dr. Nawal now I'm going to pronounce this correctly. I've written it down. Saadawi? Did I pronounce it correctly? Or Saadawi?
Saadawi.
Saadawi, okay, Saadawi. Is an internationally renowned writer and novelist. I know her by reputation, but I've never had the pleasure to meet, so I'm delighted. She's dedicated her life to fighting the oppression of women, despite tremendous opposition along the way. She's been referred to as the leading spokeswoman on the status of women in the Arab world. For decades, she's held vocal positions, extremely vocal positions promoting women's rights, and one most notably against genital cutting, but not just women, and she'll talk about it more. In response to her work advocating such positions, she has had numerous books banned. She's been imprisoned. She's appeared on death lists issued by some religious and political organizations. Her works have been translated into more than 40 languages, and she's received a number of literary awards. But I should add that in addition to being a writer, she's a physician and psychiatrist. She serves as a mentor to young advocates and has played a supportive role in 2011's revolution in Tahrir Square. I know it is very hard for her to be here right now in view of everything that's going on in Egypt. So I particularly appreciate that she made the effort to join us today. Let me then turn to Dr. Angela, who's at the end. Sorry, I'm going in the wrong order, but I'm using the alphabetical means. Angela Maria Pinzon Rondon. She's a professor of medicine at the Universidad del Rosario in Bogota. She's published extensively on street child labor in Latin America and sexual violence against children. She's emerged as a preeminent voice in the burgeoning examination of global health indicators as functions of rule of law. And I'm going to ask her to be talking about that in just a few minutes. Ms. Sabiha Husić is the director of Medica Zenica, a non-governmental organization based in Bosnia and Herzegovina. This is an organization that offers psychosocial support and medical support to women and children who are victims of war and post-war violence, including survivors of rape and other forms of war torture, sexual violence, domestic violence, as well as those who are victims of trafficking. Over the last 20 years, this organization has provided extensive services to beneficiaries, including access to a safe house for women and girls, a hotline, counseling, health services, economic empowerment, and career services. So we really and truly have a group, I would say, that has experience on the ground. And that was something that we heard in the first session, that it's very important to have people and hear the voices of those who are actually doing the work on the ground. Let me paint for you very briefly a basic picture of the tragic results that we see because of the status that women and girls have today in the world. And I want to qualify this statement right in the beginning. You know, when we say women and girls, we have to recognize that there is no such homogeneous category. Women and girls enjoy different levels of education, employment, political rights in different countries. So we do recognize that that's not a homogeneous category. But at the same time, what we can say universally, whichever level they're at, they do not occupy the same status as men in most societies that we know of. And that's the reality we're talking about here in terms of access to health. A lot has happened in the last 50 years in particular in terms of getting social justice to women and girls and in terms of access to health. But here are just some few figures to place us in terms of why we are having this discussion in the first place. 1 out of 3 girls under the age of 18 are married without their consent in low and middle income countries. 7 out of 10 women experience gender-based violence in their lifetimes, often from those who are designated by society supposedly as their, into quotes, protectors. And 1 out of 4 women experience sexual violence. According to some data that was produced by the World Bank, women aged 15 to 44 are more at risk from rape and domestic violence than from cancer, car accidents, war, and malaria combined. These are staggering figures, and I'm not giving them only to put us in a negative mode, but this is the reality that we are dealing with despite the improvement. And the improvement I always indicate is, I wouldn't be moderating this session had it been, a couple of 100 years ago as an Indian woman. I'm doing that. We have an Egyptian woman. We have women from all parts of the world in this conference. That would not have been the situation. So we have moved ahead, but there are other sisters who are not in such a good place, and those are the ones that we are trying to focus on here. A lot of the folks in this panel are going to be talking about different forms of violence against women and addressing it in the context of health. And yet, in many countries around the world, spousal abuse is not considered punishable. definitely not in at least in more than 10 countries. And even rape is often held against the woman rather than the perpetrator. We do know that those circumstances may be few, those countries may be limited, but they do continue to exist in the 21st century. Even in countries like the US, where I am based right now, they have excellent laws against gender-based violence. Social norms are quite strong. But because of the lack of social and political will and the differentials amongst social norms, again, you don't have social norms which are equitable everywhere, and paucities of safe havens for women who want to escape violent situations, there's also an ongoing trend to blame women for their own vulnerability. The situation of women is still not quite the same as we would like it to be. So it speaks to a sort of, I would say, a common lack of understanding of the way in which institutionalized discrimination operates in society and a hesitation to take these issues head on. The organization that I work for mainly focuses on sexual and reproductive health, not all aspects of health. But what do we find in our field? More than 220 million women lack the access that they want to contraception, denying them the means to determine the size of their own family and the spacing between their children. Every day, more than 800 women die from complications related to pregnancy and childbirth. They shouldn't, and it still continues. Thousands become infected with HIV or unknowingly pass the virus on to their born and unborn children. And young women make up 64% of new HIV infections among young people. Now, these data again indicate that for us, there's a lot of work to be done. This morning, we heard the importance of law, and I want this group to reflect on it a little bit. It is given, I think it's a given, that strong legislative and policy actions to further social justice, absolutely important first steps. But the second steps that everybody was talking of in the question and answers were the implementation and the education that those laws actually exist for the people who could benefit from them and the people who could be perpetrators against those laws. That education and that implementation are often lacking, and I'm going to hope that this group will talk about it. The second thing that needs to happen that didn't come up so much this morning is community engagement. If you don't have changes in social norms, laws will exist, beautiful laws will exist, but they will not be implemented because there won't be an impetus from communities to implement those laws, to take them on as your own. So in the case of gender, we're definitely going to need, if I may use the word, a revolution, but maybe that's not the word in this context, but it is a change, an alteration in terms of how we view gender, and I'm hoping to hear on that from the group. So I'm going to stop here, but I want to close with one fact, saying that this morning we heard from the index that was presented, some really valuable data on how health is related to, and you presented the data on infant mortality. I'm sure the data is very similar for maternal mortality as well in terms of rule of law. But World Bank has also presented a range of studies which indicated that health outcomes are better when other outcomes, indicators of well-being are in a better place in terms of education, employment, general ability to exercise your political rights. When they are better, health outcomes are better. So there is a very strong linkage between these two, which I'm hoping for the panel to come forth with. So I'm going to move very quickly to Mr. Briggs. I'm starting alphabetically, please note. Based on your own extensive experience, could you share with the audience your views on gender as a factor in impacting violence in particular, but health in general?
Thank you. and thank you for the opportunity to be on this amazingly distinguished panel and to represent one tiny male voice on the panel. I think it's inherent in your question. I think that there's obviously a direct impact, a direct correlation between gender and health and gender and violence. The statistics you mentioned earlier, what you highlighted earlier, kind of serves to recognize that reality. But we know that in many situations, women are more likely to be victims or targets of violence because of certain factors which are more inclined to happen among women: lower education, exposure to violence in childhood and youth, fewer economic opportunities, which makes them vulnerable to abusive relationships, and also I think being in situations where abuse and oppression and violence are accepted as social or cultural norms. Women are often be the target of that. At the same time, while women are more likely to be victims of violence, particularly gender-based violence, they're less, as they get older, they're less likely to receive the necessary healthcare, primary healthcare, obstetric and gynecological resources and access, reproductive healthcare, and crucially, when it comes to violence, because of stigma, too often women either make, it's not a choice, but they choose not to, or for whatever reason, don't seek out the necessary healthcare, psychosocial, physical healthcare they need to recover and heal from the abuse or violence they've suffered.
It's very tempting to react to what you say, but I'm not going to do that. I've spoken enough. How would you react to an often held view, and I'm sure you hear it a lot, that the involvement of men in the struggle for social justice for women and better health, in fact, is again surrendering to male hegemony and denying women the leadership that they merit in their own struggle for equality?
I hear that a lot. I hear that a lot, for sure. I think that mindset is changing. For far too long, and there are many women, many feminist thinkers and activists who feel this way and would agree with me. I think for far too long, men have been seen as solely the problem and not as allies and potentially part of the solution. I just, especially when I talk to men, but also when I talk to women, I mean, it's so blatantly obvious that I don't see, I make the argument, which is not really an argument, just to state the reality that if men are the primary perpetrators of violence and oppression, and I think we can all agree on that, then you have to engage men, you have to work towards transformation and education, altering behaviors and attitudes in order to stop the violence or prevent it from happening in the first place. I think really, coming from journalism into this space of advocacy, this is something I'm always very conscious of. I think that fear that you talk about in the question about hegemony of men and men taking control of certain spaces, I think one of the best ways to prevent that from happening is how we enter the space. For myself and for the colleagues I work with, we always stress the importance of entering this space with humility, and also recognizing that there were hundreds, if not thousands, of women most of whose names we will never know or be able to recognize publicly, who created the space for men to even stand up in the first place. Like, I cannot be sitting up here if phenomenal individuals such as the lady to my right, thinkers in Europe and the States and throughout the Arab world, on the African continent, Latin America, thousands of women, activists, thought leaders, organizers, created the space for me and many other men to be in these situations, to not only talk to men about these issues, but also to talk with women. And I think that entering the space with humility and seeing each other as allies and not as competition, competition for resources, competition for recognition, that's when you have those fears and mistrust emerge. But without, I hate this catchphrase, but I'm going to use it. Without engaging women and boys, I'm not sure how we can go any further than we have to this point in preventing violence against women and girls.
There's often a strong belief that political instability, fragility of political contexts is a major factor in denying women access to health, all their rights, in fact, and particularly the whole issue of violence becomes critical when the political context is fragile. I know you're writing a book on some of the countries which are in those situations. Can you give us even one or two examples from your work where you've seen that while this is true, change is possible even in those fragile contexts?
I guess for me, the example which is most visceral, which stands out the most, just because I've spent so much time there the past several years, is the Eastern Democratic Republic of Congo, in particular, which is a region we all recognize has been facing an incredible amount of unrest and instability throughout all levels of society for over a decade now. That's a situation, especially Eastern Congo, where you've had several wars unfold over a period of time, a relatively short period of time. You've had massive displacement, massive violence and casualties, and really, at times, a virtual complete breakdown of civil society, of the possibility of good governance. Because of that, and Congo's not alone, but because of that, we've seen profound victimization of children and women and girls, whether it's rape as a weapon of war, whether it's displacement of women and children, whether it's profound psychosocial trauma being inflicted on these communities. We've seen all those things happen. At the same time, there's incredible progress being made, incredible inspiration. You've got non-governmental organizations and governmental and NGO partnerships working with men at times, but also working with women survivors to not only share the stories, because I think again, coming from journalism, I think storytelling and recognizing these journeys is an important process of healing and even reconciliation at the end. But also, you have organizations like Women for Women and Save the Children and Heal Africa and Ponzi Hospital. You've got all these groups in Eastern Congo that are really improving the condition of survivors, female survivors, and through economic and vocational training, but also working with men to talk about the violence and the impact on men, but also work towards preventing it. So I think even in the midst of this instability and this lack of governmental will, there's a civilian response saying, if we're going to have any hope of recovering, we have to we have to speak this truth and work amongst men and with women to change this dynamic.
Thank you so much. I'm going to come back to you with another question, but I'll move to Ms. Sabiha Husić. And I'm going to ask you first to talk a little bit about your organization, Medica Zenica. If you can tell the group how you address the issue of sexual violence in Bosnia and Herzegovina, some specific examples of what you referred to as the trauma-sensitive approach. If you could tell us a little bit about that.
Thank you. I will use this opportunity to greet all of you on behalf of our women, girls, of course, men, and myself from Bosnia, and all people from Bosnia and Herzegovina. It's really an honor to have opportunity to share some experiences from Medica Zenica. I hope that some of you heard about my organization. That is first women NGO organization, was established during the war 1993 in Bosnia and Herzegovina. In that period, women and girls were systematically raped. They survived different kinds of sexual violence, but nobody speaks about it. They suffered a lot, and some women decided to break silence and to start to speak about their horrific experiences. Thanks media that spread this information all over the world, what happened in our countries. And Monica Hauser, she is feminist, gynecologist, heard all this information touched her, and she decided to come to Bosnia and Herzegovina during the war from Germany. And she encouraged us, girls and women in that period, that we try to do some concrete activities for women who survived war rape and different kinds of sexual violence. From that period till now, we try to help women and girls regarding their needs. Our moderator mentioned some of our services in our organization, that we have safe house, psychological counseling, vocational training for women and girls, SOS hotline, but also we work a lot lobby and advocacy. But when we started in that period, before more than 20 years, we really did not have that idea that we developed a big organization with all these services. But what happened is that we listened our women and girls, and regarding their needs, we try to help to help them. And also, what was very important in that period, that we as women encouraged each other, that we that we could take some concrete activities for our women and girls. When we speak about trauma, I want to be honest. When we started to work with women and girls who survived sexual violence, we did not know anything about trauma. Any words, any skills, any techniques, any therapeutical school, we didn't know. We didn't know how we can do with the people who survived different kinds of trauma. But what we know is to listen and try to answer regarding women's needs. In that period, it was clear that women and girls did not accept a lot. What they wanted is safe place. What means safe place? That we really can respect them, that we can listen them, that we believe in their stories. In that period, women felt a lot fears from their families, from the society. They were stigmatized from their families, but also from their societies. And then, step by step, we developed our organization with all these services. And also, what is very important to mention, when we, after 2 or 3 years, our work started to learn more about trauma, to get some theoretical things, approach, and then we recognize everything what we do at the beginning. We didn't know that is therapeutical approach, but we listened our heart and our intuition, and also try to listen and help women. And then we recognize that each human care has a very important role in therapeutical process, especially when we speak about sexual violence and war rape. Why? We know that these horrible kinds of trauma was caused by human beings. And then, through that approach, we as human beings also need to return or again establish trust among people. And also we recognize that each person, nevertheless, which kinds of trauma she survived, that she has some part which wasn't demolished. And that part can help women or girls or men to recover their traumatical experiences and to continue in life. It was first our small steps, but now when we looked 20 years after, we are so proud that we really succeed to help more than 1,000 women who survived war, rape, and sexual violence. But also, in that period, we had first cases who started to speak about horrible things, what happened in their family. It was a case of incest. But also women started to speak about horrible situation when regarding domestic violence. And also in 1999, we met first cases where women and girls from another countries came in Bosnia and Herzegovina, and they were victims of trafficking and human beings. And then step by step, through our organization, we try to help women and girls in our organization.
Ms. Husić, when I was listening to you, I was full of admiration because of the way you admitted that when you started, you really didn't know quite how to. I'm sure by now, you know, the kind of experience you've gained, you also know what other approaches are being used in the world. What do you think we are lacking in our approach to dealing with the issue of sexual violence and domestic violence?
Yeah, we as NGO and also other NGOs in my country try to do what we can. But when we look in my country, where I live in Bosnia and Herzegovina, regarding very hard, bad political situation, I want to share with you that we as citizens in Bosnia and Herzegovina do not have the same rights in the same country. What means it? We have country has two entities, and we have different laws. This morning we we listened about laws. But in my country, it is one country with two entities. We have different laws, and then survivors of sexual violence who lives, for example, in Federation of Bosnia and Herzegovina cannot apply for their rights if they live in Republika Srpska. That is a big problem in our country. We try to solve it. We try to push to make different kinds of advocacy in our country, but really in this situation we need support from political leaders. They need to have a will to adopt one law on the state level. But what was very good in Bosnia and Herzegovina in Federation, that women and girls who survived sexual violence had opportunity to apply for status. What means status? Status is status for civil victims of the war. It means that each woman who gets that status can get per month financial support, and also can finish some additional training, and also can get free medical support, nevertheless that she has or not health insurance. But we want to have that picture and that right for all our citizens in Bosnia and Herzegovina, not only in one part of our country, which we called Federation of Bosnia and Herzegovina.
You know, I've asked you so many questions on some of the barriers you faced, what the challenges are. Are there any specific opportunities that you see in terms of, you know, where things are going now? You mentioned some of them, but can you elaborate a little bit on that? I always like to end on an optimistic note because I want to see us going there.
I'm so optimistic, and
I know you are. That's
and also my colleagues who works with me. We know that we have a lot of problems, but when we want to create better life, we always look in positive things. That is why I think we have good results. What we also recognize as very important challenges for us when we speak about women and girls who survived sexual violence, that they need psychological support before testimony, during the testimony, and after the testimony. Most of women who survived sexual violence during the war, now, 20 years after, they need to give their testimony on the court of Hague or in the court of Bosnia and Herzegovina. That is horrible situation. Through that process, testimony process, women and girls need to return in past, and they need to speak about their horrible situation. And we recognize that in court in Hague, when they came here, they got complete support during the testimony process, when they need to give her testimony on the court. But before and after, they did not have any kinds of support and help. And then we started as a pilot project, but now we developed in 40% in our country to develop networks. We called institutional networks for support witnesses before testimony, during the testimony, after the testimony. And I think that is first networks in our region where we really recognize how to gather NGOs and representatives from different institutions can help victims and witnesses if we speak about justice. We know from our experiences, from our work with women who survived horrible things, they said, okay, I really want that perpetrators will be punished. But if she needs to give testimony, she also needs to have complete support that she can speak really about her horrific experiences.
Thank you so much, and we'll come back again.
Okay.
I'm now going to turn to Dr. Angela Maria Pinzon. Can you talk to us a little bit different context, unfortunately similar kinds of or different kinds of conflict, but still conflict. Based on your experience, could you reflect on the consequences of the Colombian armed conflict on the health of women and children? And mostly based on your experiences, yes.
Okay. Yeah, unfortunately in Colombia we have now an armed conflict, and the armed conflict is affecting particularly our women and our children. I have the opportunity to work as a consultant. I'm working right now as a consultant for UNICEF and the International Organization for Migration. And on that, I have had the opportunity to interview women and children on the effects of violence on them. Also learned that we have a high rate of migration. 8.5% of our population have migrated internally, which is a big number. We have more than 4 million displaced people, and most of these are women and children. When you talk with these women, what you find? A person that used to plant things in the countryside in Colombia, and all of a sudden, the guerrilla or the drugs dealers want that land to plant cocaine. So that person has to leave the land, otherwise she's going to be killed. So usually what happens to them, to the family, is that they kill first the husband and say, this is serious. So that's how the women and the children end up migrating by themselves. So these women come with a fragmented family to the cities. The Colombian health system is wonderful, so we have supposedly 100% coverage, or very close to 100%, but these women are covered in the place of origin. So when they migrate to the cities, they don't have coverage. And the system is wonderful. They just go to your place of origin and unaffiliate from that place so we can affiliate in the new place. But these women cannot go to the place of origin. They can get killed. And if they are brave enough, they don't have the money to pay for the tickets to go and unaffiliate from that. So it's an awful situation for the women and for the children. They don't get houses in the cities. They don't have jobs. As they were telling me, we don't know how to clean a house, we don't know how to read and write, we don't know anything about the cities. What we know is how to plant things, how to, we know the work on the countryside. I haven't even used a vacuum cleaner or something that is essential for the city. Another example, just like 2 weeks ago, we started a research project on diarrhea on children in Bogota. And we found that the displaced kids have 2 times more diarrhea than the kids that are from the cities, and more parasite infections because they are coming from the countryside. And as I told you before, we did all these diagnoses and we were supposed to refer these kids to the health providers. And we assumed that we were probably going to end treating 50% of the population because this kid didn't have health insurance because the insurance was located in a different place. We ended up treating the 100% of them because we couldn't find medical appointments for any of them. So it's really a difficult situation for these kids and for the woman.
Can I ask the next question, which is very much linked? Since you've already talked about infant disease, I will not talk about infant health. I'll talk about maternal mortality. We know that maternal mortality rates have been quite stubborn in terms of the work that is going on in order to reduce those rates is not giving us the dividends. We know that in many parts of the world, it's not giving us the dividends. In some parts of the world, we are seeing improvement in maternal mortality rates. I know that in your work, you've seen the linkage with rule of law and maternal mortality. Can you talk a little bit about that?
Yeah, of course. I'm a medical doctor. I'm a master's in public health and PhD in maternal and child health. And my husband happens to measure rule of law. And we work together a lot. So we saw a connection between the rule of law and health indicators, just talking at home about this. And we started to study how these rule of law indicators could have an impact on health. And we found that the rule of law, we did a study with the 96 countries that the rule of law index have right now, and we compare their infant mortality rates with this and the maternal mortality rates. So, well, the results are the same. We compare these two, this measure with the rule of law indicators, with controlling by GDP per capita, Gini coefficient, freedom, size of a population, health expenditure of the country, and we found that the factor that associate with the strongest association to the health outcomes is the rule of law. Even above GDP in some of the regressions. In others, depending on how you measure GDP, it's the same, but it's GDP and rule of law are the only factors that are really associated in all the regressions, even controlling by the other variables, the study. So we were thinking, why is this? And of course, corruption. If you have corruption, it's no way you're going to have a child or a mother being attended correctly. Social justice.
Right.
As well. If you're lacking social justice, we see in the country as well is that now my work is on this. So every week I see cases and cases. Last week I got a woman with a 10-year-old coming to my office, and she had had a ketoacidosis coma. This is a very bad complication of diabetes. The girl was dying 2 months ago because she didn't have insulin, and she came to my office without insulin for the last week. When I do a glucose test, it just says, high. I know it's about 1,000. The girl is already feeling bad, and she doesn't get the medicine. Why? Because our health system executives are being prized, but we have a wonderful law, but they are even better at putting barriers in between the law and the people. So they tell the mother, of course, come for the insulin. You can come every day. I don't know if you know Bogota, but Bogota is a very big city with 8 million people and a half full traffic. So they say, if you live in the north part of the city, we'll give you the medication in the south part of the city, but you need to pick it up every day. Say, no way, I work. But we are giving her the medication, that's what the law says. But in reality, those patients are not getting the medication, and this is part of what we were talking about.
Thank you so much for that, and particularly for us, those of us who work in the area of reproductive health, maternal mortality and the rule of law, the connection is known, is sort of understood a little bit, but not seen as being proven through data. So this kind of data would be extremely valuable to many of us who work in that area. So thank you so much for collecting it. Now I'll come back. There will be questions. And finally, I just want you to talk about, violence and health were never seen in the same realm for years to come. It took a long time for even World Health Organization to put violence, in the category of health. Can you share with us why you think these areas are linked, interlinked, even in policies, programs, laws, we should see them as linked?
There is an obvious link of violence and health, and it's the injuries. So this is the direct link. I mean, if you get shot, you are injured. So this is a direct link. But it goes well beyond that. When I was 17, my husband was 19, we started an organization to take care of abandoned and abused girls in Bogota. And we started noticing that those girls were experiencing problems beyond what we were expecting. I mean, we were probably expecting a little bit of post-traumatic stress disorder or even depression, but these girls were even having common illnesses more, like more diarrhea, more asthma attacks, more colds than regular kids. So that was our first impression on that. Later on, for my PhD dissertation, I used data from the demographic case survey and used the homicide rates of municipalities against the number of regular illness in kids, and found out that the municipalities with the highest rates of violence, with higher homicide rates, have kids sicker than the ones with the peaceful municipalities. And studying beyond the findings, we found out that, of course, the cortisol probably is playing a role there. And really, these kids have not only the direct trauma, the emotional trauma, but also a physical trauma. A physical trauma. We know already by this many scientific studies that the brain of these kids is different, and that the change that the violence leaves in the brains of these kids accompany them forever. These are scars that will never heal. But not only the brain, but also the immune system. Now we're thinking that definitely these kids have a depression of the immune system, and this is causing them to be sicker. I work mainly with kids because that's my background, but probably it's the same case with adults. That because kids are developing, probably these effects are easier to show.
Thank you. And last but not at all the least, I'm going to turn to Dr. Saadawi. I'd like to start with asking you to talk a little bit about the framework under which health and justice function in predominantly capitalist and patriarchal societies, and some of the factors that in that framework which create barriers for furthering women's health.
Very good question. First of all, I studied medicine in a very wrong way. I feel very alienated among medical doctors because the way we were educated is splitting of knowledge. So you become a very good physician. You graduate, and you become a very good physician, technically, but ignorant of the world. You don't know why people become sick. People become sick because they are poor, because they don't have sanitation, they don't have good housing, they don't have food. They are oppressed by religions, by political system, by colonialism, by capitalism, by patriarchy. Nobody taught us that in the medical college. So that's why medical doctors graduate to make money. To make money. It's really a profession that I am not proud to be part of it. That's why I became a novelist, a writer. And I teach creativity and dissidence. And here comes the law. I feel very out of place in this conference. This is a conference about justice. I haven't seen justice in the organization of this conference, because I should have been at the plenary to speak about the Egyptian revolution. I came from Cairo, and everybody in the world speaking about the Egyptian revolution. And I was prevented from speaking about the Egyptian revolution. You see, this is violence against me. This is violence against me. So violence is not just sexual violence. Women issues is not just sex and all that. This is splitting. Women are half the society in any country. So women issues are political, economic, social, sexual, mental, physical, and unless we really have this multidisciplinary approach to health, we are going nowhere. Mm-hmm. And, you know, we are here in The Hague, the city where the International Criminal Court is. Mm-hmm. Mm-hmm. Do you have justice in the International Criminal Court? They never asked or questioned a big criminal of war like George Bush. But they asked small little dictators in Africa or Asia or in the Arab world like Saddam Hussein and Gaddafi. So where is justice? Where is justice? I am speaking. Because I have only a few minutes. And intentionally, they wanted me to be silent here. Of course, the audience, I respect the audience who came here. Maybe 50 people are more valuable than 600. But what I would like to say, unless we have the courage to speak up, I spoke against Nasser, Sadat, Mubarak, Morsi, and I went to prison. I lost my job. My name was on the death list. I lived in exile just to speak my mind. So if I don't speak my mind here, why should I be here? Let me come to your question. Yeah. You have a very good question, excellent question. The relationship between health, women, capitalism, patriarchy, religion. This is the whole package, especially women. In a patriarchy, we women are oppressed by male domination in the family and in the state, by global politics against women, by religion, not only Islam, because some people think that in our countries we are oppressed because of Islam. Christianity and Judaism and Buddhism, all religions oppress women. It's not only Islam. But in the West here, they say, oh, Islamic fundamentalism. But religious fundamentalism is a global phenomenon. That's true. And it is. You know, usually I say George Bush and bin Laden are twins. And who is supporting the Muslim brothers who are oppressing women? We had our revolution in Egypt, right. And then they pushed women aside, and the US government paid millions of dollars to the Muslim brothers to have the rule in Egypt. and to oppress women, though they speak about the rights of women. How can we understand this very contradictory capitalist patriarchal world? How can we understand these contradictions? And it affects the health. Because now I am oppressed, so I am angry. So this affects my mental health. Well, anyway, I teach creativity and dissidence because I had to live in exile. And I was teaching in progressive universities in the US because some universities didn't want me to speak or to teach. But I was teaching in Duke and in other progressive universities. Why creativity and dissidence? Because I am a dissident writer. I am a dissident doctor. I am against this commercialization of the medical profession or any profession. I am against that. So how can I fight back patriarchy, capitalism, and all that? So I had to teach creativity and dissidence. When the law is unjust, you have to break it. You have to break the law. If the law is unjust, that's revolution. That's what's happening in Egypt. Now we have a revolution in Egypt against poverty, against oppression. 50% of the people in Egypt living under the poverty line, $2 a day, 50%. And why we have poverty? We are a very rich country in Egypt. Poverty is forced on us by colonial rule, by the Americans, by the American aid. Now, Obama is threatening the Egyptians, the revolution, that they are going to cut the aid. And I said, okay, happy, we should cut the aid. We don't need the aid. You know, the aid go back to the US. We, the people in Egypt, we don't benefit from the American aid. It's the US who benefit from the aid, not us. And in fact, the aid brought a lot of poverty to Egypt. Poverty increased after the aid. Since that, poverty increased and diseases increased. Physical and mental diseases increased. So the problem is we need to change the medical education. First of all, we need to change the political economic system because it is the power. Politics dominate everything. So we have to, that's the revolution. And when we have this political revolution, then we have economic revolution, then we have cultural revolution, educational revolution, including revolution in the medical education. Because the way we are educated as medical doctors does not help, especially poor people and especially women. And that's what your question about capitalism and patriarchy. Right. When money is the boss, right. When men dominate globally and in the state and in the family, then women are at the bottom, especially poor women. And that's why diseases, women are the first to die in the revolution. They are the first to be sick. They are the first to be dismissed from the workplace if you have any economic crisis or anything.
My second question
I hope I answered you.
No, you did more than that, because my second question was going to be about asking you to reflect on what's going on in Egypt, but you have reflected on it quite extensively and quite usefully. I think the group, we would not have let you go without talking about it, because it is at the forefront of everybody's mind right now. So thank you very much for going into it. But I'm going to use this opportunity because I know you've worked on many areas, so I'm going to take this opportunity since the session is very women-focused, but we're going to move a little bit away from that in talking about culture, because that is, culture and religion are two areas in which you have written extensively and have very strong views. they're always raised as red flags when organizations are talking about male genital cutting and female genital cutting. Can you tell us, in your view, where you see this issue as being placed in the context of health and rights?
Yes. I've been fighting against cutting children, male genital mutilation and female genital mutilation. Of course, the whole world now is speaking loudly against female genital mutilation, but they never speak about male genital mutilation. Why? Why? We have to ask ourselves why. Why? Though cutting male children when they are only 1 week is very dangerous. And one of the causes of aggression in the world, and wars and violence, especially male violence, is related to this shock when the male child is cut when he is less than 8 days. So there is a psychological problem. It's not only a psychological trauma, it's a physical trauma. Depriving the male child of some of the very important parts of his body, the cover of the head of the penis, which is full of nerves and blood vessels. And when you cut the normal cover of the head of the penis, then you are damaging the penis and sexuality. And that's why the sexual life of people who are circumcised, female or male, is quite miserable.
Dr. Saadawi, can I interrupt? Because there are two things here that I'm a little confused by. One is that female genital cutting happens relatively late and is often known in many contexts to be literally cutting. And in some places it's vulva, in some places it's just labia. It's very, very different.
Clitoris.
Yes, clitoris. It's very different in different cultures, and it's conducted in some contexts by medical professionals even, in order to keep it hygienic, supposedly. In some cultures, it's not. So it's done in a very different way, and male genital cutting, if you want to call it that, is done relatively early. Generally, these are not put in the same box in terms of how they happen, why they happen, and female genital cutting often being to reduce sexual pleasure for the woman, in fact, rather than increase. That's one aspect. The second thing is HIV, because I work in the field of HIV. Now, WHO is promoting in a very big way male circumcision for prevention of HIV. Mm-hmm. In that context, this becomes a serious issue if you say that male, genital circumcision is an issue, because they're promoting it. And in many African countries, which do not, some African countries, it is considered acceptable and done. In some, it's not. And even in those countries, it's being encouraged and doctors are being trained in how to do it. So where do we stand in terms of this? And I know you're a physician, even though you're not the classic physician that we would talk about.
Well,
yes, that's the question, yes.
Well, I think I recommend that you read a book called Emerging Viruses. The new viruses emerging like HIV, especially in Africa. African people are used as guinea pigs for American pharmaceutical companies. And that's why doctors are paid by pharmaceutical companies to praise male cutting. You see, you cannot separate health from economics from politics, because we live in a very unjust world. Power dominates. It's power and money that dominates, and companies, the so-called free market. Pharmaceutical companies, they dominate health. They dominate doctors because they pay them a lot of money. So, under vaccination, they were doing some, maybe minute, I'm looking at somebody here saying, are happy to hear that. If you go to Africa, why HIV flourished in Africa? Why? After pharmaceutical companies started vaccination campaigns, which new viruses emerged in Africa, using African people as guinea pigs. And that's why many doctors in Africa, they don't speak about the dangers of male cutting. And they say, you know, circumcision of men is very good because it prevents HIV and it prevents cancer. Maybe you read that too.
No, yeah, I've heard that, yes.
There are, you know, science is not neutral. Science and medicine is dominated by politics and money. So you find a lot of misinformation in science. You find a lot of, it's like religion, science like religion. You find a lot of misinformation in religion and misinformation in science. One of the misinformation is that cutting of women, you know, medical doctors in Egypt, they were saying female circumcision or female genital mutilation is very good for the health of women. And male cutting circumcision is also good for the health. It prevents cancer, it prevents HIV, it prevents so and so. This is not true. It's not medically founded.
Dr. Saadawi, we have so many reactions from the audience and we don't have much time, so I'm going to open the floor quickly. I'm going to tell you which hands I've seen first, and then I'll come to the other side. 1, 2, and 3, and then I'll go to, I'm sorry if I'm giving the men the chance first, but they put their hands up first. Okay, and then you, and then I'll come to the others. Please, the back there. We have mics here, actually.
If you
can come here, there are mics here. We don't have anybody to take them around, unfortunately. Oh, wonderful. Thank you. If you make sure that it's on.
No. Please come here. I want to see you. I want to see you.
Dr. Saadawi,
come here. Yeah.
Professor Amir Atarin from the University of Ottawa. I have a great amount of respect
let me come nearer to you, because I can't hear well.
Okay, I have a great amount of respect for much of what you said.
Mm-hmm. You're a doctor.
But as a scientist and a lawyer, what you are saying about male circumcision is just factually incorrect when it comes to HIV.
Professor University of Ottawa.
And I see people on your panel nodding. There is, of course, an influence of business and commerce in the pharmaceutical industry on scientific and clinical evidence, of course. And it is not always a benign influence, of course. But the argument that there is not an evidence base for male circumcision reducing the incidence of HIV is one of the least truthful things I've ever heard come from a scientist's mouth.
Really?
So I'm very, very bothered to hear you say that.
Professor of what?
Law and medicine. And
you teach law?
My PhD is also in immunology. So let me be absolutely clear with you, okay? While I respect a great deal of what you said, and politically probably see eye to eye with you on many things, let us not indulge the point of view that controlled clinical studies, which have shown time and time again that male circumcision reduces risk of HIV transmission to women, is an intervention we should rule out. That is scientifically irresponsible.
Well, I'm sorry to say, we cannot discuss this medical
I don't think we need to.
I cannot discuss it here.
That's okay.
Because
please,
I have other views. Yes.
Yeah, one of the issues and one of the questions that I have always asked, by the way, I wrote a book on the whole issue of global healthcare and the pharmaceutical industry.
Who's speaking?
Here, Ibis Sanchez Serrano from Panama.
Yeah, and, can you do one thing?
And
can
the question,
identify yourself?
Yes, okay. Yes, my name is.
Can you come?
Of course, I will be very happy to. My name is Okay.
You may just identify yourself.
And, can you put the
and
mic a little bit
please
away?
keep your question brief. And the question is
Yeah.
to all four.
Of course. Yeah.
Please don't address your questions just to one person. It wouldn't be fair. We have 4 panelists here.
Yeah, well, my name is Ibi Sanchez Serrano, and I'm a scientist by training. I'm a geneticist, and I work on healthcare and pharmaceuticals development worldwide. The questions that I have is the following. We always see a complaint about the inequality of women in the world. Now, it is women who, in general, are responsible for the child rearing and the bringing up of men. So how could we capitalize on that in order to change the situation? That is one question.
Good question.
The second one is about when we talk about global health care and access to medicine and all what you have talked about, I wonder if there are any statistics about the difference between having access to health care between men and women worldwide. I'm not talking about just specific sectors of the low-income countries, but in general, and what those numbers are, if someone has it, because I haven't seen them, and I would like to know. So.
Okay. Can we wait and take about 4 or 5 questions, because we don't have that much time.
Who was 3?
He was 3. Thank you. 4 is the lady at the back there. And she's 5. And then there was somebody here at the 6.
So I'm so happy that to hear this wonderful panel about health and access to health. I'm also a medical doctor and human rights activist. That I started the first HIV program in Iran, which was documented by the United Nations as a best practice in the Middle East. But as my colleagues said, there is no evidence against those procedures. They are all for reduce HIV in Africa. I believe that there is a lot of discrimination against women and children on health, but instead of giving wrong information, we have to emphasize on right information. And we all have a lot of evidence about the source of HIV, how they started in Africa. They belong to not human, they belong to animals, but there was a custom of some rural area that they used those animals and they cut themselves and they got the virus. So this is all evidence-based. It's now 35 years after those. So I think it's better that we emphasize a lot of things. So I was in prison for 2.5 years in Iran because I was working on HIV/AIDS. But when I was released, I didn't try to jeopardize against my work in the past or blame of some pharmaceutical companies. They may be looking for the profit like other businesses, but at the same time they are providing some programs. Even during the Bush administration, I am not happy with what he did in Afghanistan or in Iraq, but during his presidency, he initiated PEPFAR projects with $15 billion to treat HIV. So we cannot judge people. Maybe we have some people that they are not the good people, but there are some people that they work in those administrations to save people. So HIV is one of that. But another project that I am working is maternal and child mortality in Afghanistan, because Afghanistan has the highest rate of maternal and child mortality, that this is even 90% of the women knows about family planning, but only 10% use those. As you mentioned, it's due to the culture. We have to emphasize on culture. At the same time, we blame on the political issues, but a lot of them are due to culture. Thank you so much.
Thank you. Yes, please.
Thank you. My name is Natalia Gerardi. I am a lawyer and I work in Argentina on issues of gender and justice. The comment and question I wanted to make is that at least in Argentina and in Latin America, we have advanced quite substantially in violence against women. But progress has been made basically in the area of the law. We have a whole new set of laws and legal proceedings to attempting to protect women from violence. There is an increasing interest in the media and in the political arena regarding different forms of violence against women. But the concern that I wanted to ask your opinion on is, at least in Argentina and in Latin America, we are only discussing the most obvious forms of violence, the most evident forms of violence. Physical violence and sexual violence appears to be unacceptable for most part of our society. But that, I think, that obscures the fact that there are only laws, but not sound public policies, adequately financed public policies to make those laws operate in practice, to make those laws actually accessible to women who are victims of violence. And also that obscures the fact that as a society we find unacceptable only the most obvious forms of violence against what we considered innocent victims. But when the woman or the young lady or the girl doesn't behave as innocently as we would expect a woman victim of violence should, then all the legal protection completely runs out and is not available. And then, so I wanted to ask your views about that, and also about all this politically correct importance on violence against women. Isn't it obscuring other problems such as sexual and reproductive rights and the issues of abortion? Because at least in Argentina, we speak so loudly about violence against women as if lack of safe abortion procedures was not another form of violence that ends up with the lives of these women.
Thank you so much for something that I was going to say at the end that we haven't touched on. Many of the sexual and reproductive rights that, for example, my organization works on, but we'll come to that. I'm going to take as many questions as I can. I'm looking at the time because then I'm going to give each one of them, if whichever question they'd like to take the possibility to give their reactions very briefly, because we'll have to, the next session starts at 4:15. Yes.
I'm Dr. Joe Dumaki, President Campaign for Democracy and President Women Arise for Change Initiative from Nigeria. I've also been imprisoned about 17 times for various offenses, but and of recent, I'm glad I made Secretary Kerry International Women of Courage Award. That was March. Well, I'm so glad to be at this epoch-making event and talking about access to health, better life for women and girls is quite interesting and an eye-opener to have listened to all shades of view from the United States, Egypt, to Colombia, and Bosnia, and etc. But one thing that has been a recurring decimal in trying to treat this issue of this access to health, because like from what we've heard, there's really no dichotomy between health, violence. They are all interwoven as a result of the fact that women, a lot of them are ignorant, they are poor, they are not empowered. But from all the shades of opinions that I've listened to, I think more than ever, for us to have a freer world, better life, for us to put smiles on the faces of our women and girls who continuously are the lubricants for the survival of any nation, I think we have to also put the issue, like has been mentioned, but we have to reiterate the fact, the issue of maternal mortality that has eaten into the fabrics of our womanhood. And I really think that by the time we re-emphasize and mention these facts, we are going to have our women suffer less from this, because they suffer that, and we see that a lot of our great women seated here with our men. What would have happened if they have been victims of this maternal mortality? So by the time we have lots of enlightenment, empowerment, and also help our women, we'll have a freer and better world. Thank you.
Thank you. I'm going to make a request that if you want others to speak, you will all have to be very brief, because it is impossible to accommodate all the hands that have gone up, but please.
Thank you. I want to say that post-Beijing, 1995, the discourse on gender equality has changed a lot. That prior to 95, we only talk about women issues, and I think after that, we have seen a change in the world in terms of the way we deal with men and women, the whole concept of gender. I think we need to understand that, and I'm very happy that we have a gentleman up there, as well as lots of gentlemen here, and I want to congratulate them for coming here. Now, we also have to look at political will of our governments right across the spectrum. Because if our governments don't believe in gender equality, who is going to do it for us? So we need to start looking within our respective countries as to what our governments are concerned about. If we're saying we're half of the world's population, how come we're not there when decisions are made, or we're not in the corridors of power? So that is where we should be in order to change the discourse and dialogue with respect to equity and equality issues. The other thing has to do with the role of religion and also customs and traditions. Why is it that it is the women who are perpetuating certain tendencies? For example, when we talk about female genital mutilation, when we talk about arranged marriages, when we talk about dowry burning, a lot of these things women are being used to perpetuate these against their girl children. The way boys and girls are socialized is completely different. And so we have to ask ourselves also as women whether we are not partly responsible for the perpetuating of these negative stereotypes against our girls. There are countries around the world where girls are denied inheritance, and mothers allow that to happen. How come we do not stand up and say enough is enough? That we believe the time has come when we mothers or we women should take a stand or take a position. Thank you.
Thank you. I'm glad that you're getting an answer to in some ways to your own question, recognizing that we do still live in mainly a male-dominated world. So we may be women, but we are often subscribing to the norms of that society, and that society tells you what a woman does and what a man does, which is not the same. And I think it's important that while we work on women, we work on men as well. That's why what Jimmie said was so critical to this meeting. We have a question here in Spanish, but I think it's for Angela, so she will translate the question because we don't have translation possibilities. Very brief.
Thank you, muchas gracias. Mi nombre es Angélica, soy de Nicaragua y activista de derechos humanos en salud sexual y reproductiva.
¿Puedes repetir que no te oí?
Mi nombre es Angélica, vengo de Nicaragua. Activista de derechos humanos en salud sexual y reproductiva. En salud sexual y reproductiva.
Sexual and reproductive health.
Okay. Realmente el tema de derechos humanos, el tema me interesa mucho desde la salud.
She's very interested in health topics.
Traigo 3 estudios que demuestran que el aborto terapéutico es un derecho humano en Centroamérica.
She has 3 studies that show that the therapeutic abortion is a right for people in Central America.
Uno de ellos dice la situación del aborto en Centroamérica.
One of them is about the abortion situation in Central America.
Cumplen los estados con garantizar el derecho a la vida y la salud de las mujeres.
Are states fulfilling the rights of women, the human rights on sexual and reproductive health? The other one?
El aborto terapéutico 24 voces.
And the therapeutic abortion 24 voices.
Servicios de salud para víctimas de sobrevivientes.
Health services for survivors.
He querido compartir nada más los títulos de este documento y sí reconsidero.
She wants to share with us the titles of the documents.
Okay.
Que el aborto es un derecho humano.
And she thinks that this is
es un derecho de las mujeres.
Como a human right.
Ajá. Y no debe ser concebido desde una ideología religiosa patriarcal.
And the religious ideology shouldn't play a part on this.
Thank you. Gracias.
Thank you. I think that's, as was pointed out rightly by another participant, we really haven't talked about reproductive rights at all, not very much at least in this session, because abortion is an issue that nobody has raised. And it's an issue on which Pathfinder also works very, very extensively along with many, many partners. It's an important right, you know, to get abortion on the radar of reproductive rights is itself a challenge, especially in the United States, as you know, but also in many other contexts. So for us to be talking about it is important, but there's a lot of work that needs to happen. Now, I'm going to take 2-3 more questions, and then we're going to have to turn. You've already spoken, ma'am. So please. Yes. And you after that. Yes, please. No, you will need a mic. Does anybody have is anybody holding on to a mic? Because we had 2, and now we have 1 only. So somebody must be holding on to 1. Can you pass it here, please? Just pass it. Yes, thank you.
Yeah,
yes,
hello,
please.
I shall be short. My name is Frank. I'm the medical doctor, Chief Medical Officer, Public Health in Norway. I have a question for several of you.
Please, if you can ask only 1 or 2 questions.
It's just 1 question.
Yeah.
But several of the panel have mentioned the problem with socio-economical injustice. I got a video from Gapminder. Hans Rosling is professor at Karolinska. Yeah. He's working for WHO. He says that we are closing the gap now. Mm-hmm. It's only Congo and Afghanistan that has that problem in dimension. Who is correct, you or Hans Rosling?
Can you? I've just recently heard Hans Rosling. So what did he say that I couldn't understand? He said that the socio-economic gap between men and women is reducing.
No, the economical. The poor are richer, so the money is transferred from richer people to poor, and the poverty make bad health. So people have it's lesser with. Mothers dying after birth, for example. You can go to gapminder.org.
Yeah.
Gapminder.org.
No, I've heard him several times, and I had not picked up this specific. Yeah, okay. This lady here. They're here, right here. Thank you.
Thank you very much, and thanks to the panel. I just want to ask a question linking prostitution, sex trafficking with violence against women, because a lot of the literature I see...
Prostitution and sex trafficking are not the same thing, so let's not convolute them. They are often convoluted in the US context, but they're not the same thing. That is a debate by itself, I know, but I would like to state my own views very clearly. They're 2 different things, and they should be dealt with in 2 different ways. That's my view.
I feel a bit of violence from you because I hadn't finished. I said
no violence, ma'am. I just wanted to, because you asked the question, I posed it that way. Please go ahead. Please go ahead.
Okay, let me start. I never said they are the same. I just said the link between prostitution and sex trafficking, and the link is established. I didn't say they are the same.
Okay.
But I was speaking about the link.
Okay.
Because if you look at any report, including the United Nations report, the large majority of those who are trafficked for commercial sexual exploitation. So here is my point. I was starting to say, literature talking about violence against women seems to overlook this issue that I've just raised. If you look at the issue of the sexual health of women in prostitution, many of them die very young. Many of them carry the virus, HIV virus. And the issue then that I'm bringing to this as a question, why is it that the criminality in relation to prostitution seems to be put on women? A lot of laws in a number of countries criminalize the women, and yet the buyers and those who profit from the industry are not at all criminalized, except for Sweden, which is leading the way. And when we come to the rule of law, why is it that those who are exploiting women, who are causing early death among women by prostituting them, are not actually targeted?
Yeah.
And just finally, it's the same question. I appreciate the work that ManUp is doing, and I would like to see more attention to eliminating the demand for exploiting women's bodies. Thank you.
If there is a lull, then we will stop here and turn to the group, because we don't have as much time for their answers. And I'd like to give them time, since there's been such a range of very rich reactions. I think there have been more reactions than questions, but there have been some questions, so it is important to turn to the group. So can we start with Angela?
Okay, I would like to touch in 3 topics that have been asked. One of them is maternal mortality, and it's definitely linked to the rule of law. And an article that we received last week from Afghanistan, was that article, where shows how the medicine to contract the uterus, I don't know if you are aware that the main cause of death for a woman after delivery is bleeding. So there are medications to stop that bleeding. And they found, in many developing countries, it have been found that those medications are not good. So the quality of the medicine is not good. You inject it and it's like a placebo. So of course these women are dying because of the quality of the medicine. So just another example of how the rule of law is linked to maternal mortality. And also maternal mortality, we still have a lot of teen pregnancy, and we know that the pregnancies during early ages are related with maternal mortality. And at least in Latin America, because I don't know many other places, the problem is increasing. The campaigns that we have done to stop teen pregnancy are increasing them. So it's been hard on us, although in general maternal mortality is decreasing because prenatal care is being offered and many other things are happening. This is still a lot of things to do on that. The second thing that I want to touch is about culture and the role of women and in the society. And I've been confronted by my own patients and because I told them my views many times. I say women are empowered. I do not agree with genital mutilation. You should use family planning. And really, when you are with the patient on the other side, it's not as easy because they really can have beliefs and that I come home at night and say, I don't know if I should really insist that my view is correct, if I am being a good doctor just by trying to, for my point of view to be over the point of view of the patient. Mm-hmm. If this is the right thing to do, it's more like a personal reflection. Or if I should just listen and let that person be free. Is in between the freedom of that person and the thing that I think is correct. And really, it really strikes me, particularly with the genital mutilation, because I will be willing to think about abortion and family planning easily. But the genital mutilation is really, I get home and get disturbed by those rights. What should be considered first? Okay. And
maybe Angela, if it's okay to give the others an opportunity, if you can just take 2. Jimmie, if you can go next. If there's anything specific.
There's a lot. To be honest, I was overwhelmed, I can confess that. But I think the most obvious question or point to take, and which I appreciated, was from the physician from Argentina. I'm sorry for pointing. Hello, hi. Would you talk? Lawyer, I'm sorry, lawyer, okay. Lawyer from Argentina, in terms of talking about this issue of the most obvious forms of violence against women and girls. It's something, I think it's a universal challenge. It's interesting to hear how it plays out in your country and region. And as you were talking, it just brought up a lot of conversations, or lack thereof, which I've had in the States and other places. I think one of the big issues is the lack of contextualization for the general public. I think most people, when they hear violence against women and girls, to your point, they immediately bring up the most visceral, obvious examples, whether it's domestic violence, rape, or things like that. But they're not really introduced to the issue of violence against women and girls in the larger context. In other words, we don't draw the connections between sexual health, reproductive health, and violence and equality as advocates or as service providers. And I think that's really doing a disservice to really affecting change. We're talking about the symptoms, but not really talking about why the violence is happening or where it comes from. I also think, and it kind of goes to, if I may, not to be awkward, it goes to the exchange that you two just had, because I think that I tread very lightly, even for myself, when I talk about these issues. There is disagreement within the community on what is violence or what is oppression. I mean, as was very clear right here, some organizations and individuals, and some very large organizations and foundations are very adamant about how we talk about prostitution, for example, how we talk about trafficking, and they're not the same. There are ties between them at times, but they're not the same. But there's, because there's no agreement, even within the community, among feminists, there's no agreement, there's no clear consensus on if prostitution is sex work or if it's exploitation, or pornography is sex work or it's exploitation. So, those situations make it difficult sometimes to even within the community, to talk about what is violence and how do we address it, or what policies we should be focusing on. Obviously, there's disagreement on abortion and how, in the context it fits in within reproductive health rights. I know for myself, with ManUp, we've been striving to engage faith-based partners, faith-based institutions, churches, mosques, and synagogues, because, from my perspective, if I'm trying to engage or alter the behavior of men and mobilize men, young men, on these gender-related issues, we have to go where they are. And sometimes they're in faith-based situations, sometimes they're in the pub, sometimes they're on the football field, but you have to go where they are. And in some of these spaces, there's a lot of ignorance, and there's a deep conservatism around a woman's right to have an abortion or make certain reproductive health choices. So, again, that's another situation where it's difficult to find that common ground. Like, how do I talk about gender equality and reproductive health rights with a male who's in a faith-based perspective, who doesn't believe a woman should have those rights, but maybe they agree that a woman shouldn't be beaten or raped. So it's really kind of this maze to try to figure out where the common ground is, so we can talk about this, but we better not talk about this, And I think whether it's trafficking, prostitution, pornography, for me, those are the issues where I find a lot of tension and challenge. I mean, it's really low-hanging fruit to talk about rape and domestic violence. Most men, I can safely say most men think it's wrong to hit a woman or rape a woman. That's low-hanging fruit. But you start talking about, prostitution and abortion and pornography, a lot of people don't think pornography is wrong. I mean, you're not hurting anyone. That's the argument. So, I mean, that's what they'll say. Most men will say, pornography, I'm not hurting anyone. It's just me and my computer screen. So, how do you, it's like trying to work through that conversation is much more nuanced and complicated. And I think too often we don't want to have it. We want to go, the immediate response, the immediate success, and bring, when you introduce these nuances in the conversation, whether it's internally in the community or trying to make the sell, if you will, make the pitch to the public, it's much more difficult. And most of us don't want to make the difficult pitch.
Okay, we really have run out of time, but I want to give the two the floor. So Sabiha and then
I want
Dr.
to be very short.
Yeah.
Through this topic, create better life for women and girls, we open it a lot topics. But what means from from my side, that we really need more time, more place for this topic. It is not enough, one panel, for this module that we can answer for these all topics and questions. But it's clear that we recognize a lot problem. Some of them we try to solve, some of them we name. But however, I really think that we as women can recognize our strengths and start with start to fight for our better solution or better life. If we will wait to do government or political leaders, I think that we can wait 100 years, but we will not get what we want. Thank you.
Thank you. Dr.
Let's think about the future. I hope that we'll have a better future, better health systems. But we have to use our common sense. Creativity means using our common sense. We lose our common sense by education. So when some people say, and medical doctors say, we have to cut children, male or female, to cut part of the body, part of the healthy body, a healthy part of the body, we have to cut it to prevent diseases or being dirty or something. This is against common sense. Because I cannot cut my ear because there will be wax here. I have to clean my ear. The same, we have to create medicine, ways of prevention of diseases, and not cutting healthy parts of the male or female body. That's common sense, without going to facts and saying whether this prevents HIV or not. I usually go to the common sense. We should not cut a healthy part of the body of a child or anybody. Healthy. This is a crime. We can cut a part that is diseased, but to cut a healthy part, this is a crime. That's number one. Number two, I would like culture and religion and all that. Religion is a political ideology. I spent 10 years of my life studying religions, comparing Judaism to Christianity to Islam and holy books. Religion is a very political, economic, social, sexual ideology. And I didn't find morality, only double morality in religion. Morality to men and morality to women. Culture, the same. What is culture? Culture is politics and economics and all that. So we are so mixed up by the word culture. We don't know what does it mean. But at the end, it is politics. I would like to say that we need to broaden our conception of health. Health is not that there are no diseases. No. Health means social health, political health, economic health, sexual health. To broaden this conception of health, that we studied health in our medical schools in a very narrow way. Also now, how to change medical education. I attended some schools, some medical schools in the US and Europe and some other places. And you know now they teach music and literature for medical students. Why? I was invited to one of the very progressive medical schools in Duke. And I was invited to speak about literature, about art, about creative work. And they teach music in good medical schools. Because when a medical doctor can taste music, can understand music, he is a better human being, or she is a better human being, and they can sympathize with the sick people or the poor people. So we need to broaden the medical education. We need the link between the global and the local. Now we use one word, we use the word glocal. Glocal means we live in one world, not 3 or 4, one world, dominated by the same system, capitalist, patriarchal, religious systems. Poor people and women are oppressed, and we are all in the same boat. I came from Egypt. The revolution in Egypt. I was at Wall Street in the revolution in New York. I was at St. Paul in London. People are revolting against the capitalist, patriarchal military system. So we are all in the same boat, and we have to fight together, men and women. Thank you very much.
Thank you. I think we've had a really excellent panel discussion, but excellent participation from the audience, and I wish we could have continued more. I know there were several subjects we couldn't touch upon, and I definitely felt that with World Population Day coming up only 2 days from now, with the theme being teenage pregnancy, your issue and reference to teenage pregnancy was particularly poignant for me. And I think for all of us, that is an area that we need to be talking about much more. I also want to remind everybody that the incubator session, which we are having right now, which is going to be led by the gentleman there, I didn't catch your name, I'm sorry, is actually going to do, the focus is going to be quite a bit on maternal health, because that is another area that we didn't talk about very much, and we hope that you will join us in that session so we can have more discussions. So pardon me if I've offended anybody, pardon any of us if we've offended anybody. The idea was to get a good debate and a discussion going, and in good debates and discussions, we don't always agree, and that's okay. That's the important thing, because debate and discussions actually help us to move forward. So thanks a lot.
Thank you.